In today's day and age, health anxiety is prevalent. Earlier this week, I had a conversation with Dr. Sundar, and I'm thrilled to share excerpts of the discussion with you. Dr. Shankaran Sundar is one of the leading nephrologists in our country today. He completed his nephrology training in CMC Vellore. He then went on to establish the Nephrology and Transplant Unit in MS Ramaya in 1987. He was also one of the founding members of the Nephrology and Transplant Institution in Karnataka. He was awarded with the Dronacharya Award from the Association of Vascular Access and Interventional Renal Physicians. He has also been given the Lifetime Achievement Award for help rendered to kidney patients by the Karnataka Nephrology Association. He has managed over 3,000 kidney transplants in his career so far. So, doctor, you have been there through the entire internet revolution. Those days, people did not have the internet to go check. So, when they came to the doctor, they were like, okay, you know everything. Our health is in your hands. Please just take care of us. But now, they do their own like Google research before coming. Do you think that's okay for them? How do you think this affects them and their treatment?
I think it's a very good question, Lakshmi, you asked. I started my practice more or less, I could say. I entered the medical profession as a MBBS doctor. I finished my MBBS in 1976. So it's nearly 45, nearly 50 years in the field. Definitely the last 20 years or so, where the internet and Google has come in, there's a profound change in many things in our day-to-day practice. But I think it's not just medical practice. The problem is the the question of the problem of plenty. There's so much of choice. See, in our
Yeah.
days, you had no choice. You had to watch it. But now you got
Yeah.
so many channels. You don't know what to watch. They have got so much of information. They have lost trust. Because I go by what is called experience. But the present day patient
Yes.
wants for evidence. Everything is evidence.
Yeah.
The present generation, like you doctors, you are in a better position because you have seen this side of the story only. You've not seen the previous side, which I have been in the field. As a senior doctor, I find it very difficult to practice now because so much of information is there and the patient has no trust. Actually, I feel sorry for the patient. That is my feeling.
Yes. So, doctor, what I've realized is they have a lot more fear these days. They're not comfortable eating and, doing their regular daily activities. Like, say, okay, they've already done like half research and then they're like, okay, I'm having like these symptoms. Okay, so I can't eat this or I can't do this. Is this okay? Is that okay? And I've also found that there's a rise in allergies. Do you find the same in your practice?
One of the reasons I personally feel is in our generation, there is nothing like hygiene or something like that. We would go out and play in the sand. As a kid, nobody bothered watching the hand. All that was not there. Maybe our immune system in the older generation was much superior, and that is the reason. Maybe because we are so hygienic and so this whether allergies increase because of that and pollution. I don't know. I mean, this is one theory, but well, I find this when my kids, they are staying abroad and they come here. Suddenly, their kids react differently. It's the simple thing like a mosquito bite. We have mosquito bite, nothing happens. You just scratch and you forget it. But for my granddaughter, the moment the mosquito bites, the whole hand has become red because she has allergic to mosquito bite, which I never knew such thing could occur. But I think that would be my feeling that because we are so careful, the allergies have increased. I feel.
So, doctor, cardiophobia is also something that I want to talk about. These days, so many patients come with that fear. Of course, it's because of the increasing cases that they're there as well, but they're really scared. Like, for example, the Garba cases in Gujarat, also so many younger male patients that I am seeing these days. But the fear is there. It's innately, present as like, okay, what is happening? Am I doing everything okay? Is my heart health going to be okay? What do you feel about this?
Just like you say, cardiophobia, I think we should have cardiophilia, love for the heart. Same way, like nephrophobia. A lot of patients come to me in my own practice. Now what is the a new definition? They use what is called the EGFR, estimated glomerular filtration rate. Based on the EGFR, 10% of all Americans have got what is called as chronic kidney disease. 10%. It is a diagnosis based on your lab parameter. He goes to the lab, they get one EGFR or something done, and then their GFR is 60 or 70. In my mind, for their weight, height, it is normal. But they have been labeled in the CKD, chronic kidney disease type 1 or 2, and they are shattered because they know that once you say kidney disease, it is dialysis, transplant, they are shattered. So, this is what is occurring in the heart field also. Nowadays, the old father is bringing the young son with a heart attack. It's definitely increasing. But is there a reason to get everybody to get go and get their angiogram done and ECG done, treadmill done, and in the bargain become a patient? I don't know. That is the question which I think we need more research because most of the data we have, all Western data. We don't have Indian data. We need Indian data. Labs have to have Indian data to say this is abnormal, this is the Indian parameter, and go ahead. But your point you rightly said is I feel the cardiophobia is actually more dangerous. So, in my opinion, fear of the disease is worse than the disease itself. So, I think we need to have a clear mind. I personally feel I don't advise anybody to go for a master check. I'm telling you honestly. I say you must have a family physician. This is what is dying now. Our country, unfortunately, we don't have family physician. We need you, Lakshmi, what you do. You are a good family physician. You take charge of everything. It is not just kidney. So because the body is the whole body is all organs together. It is not brain separate, heart separate, nose separate. They're all connected. Now what is happening? Somebody having chest pain, go to cardiologist. Somebody having some little back pain, go to kidney specialist. One left ear pain, left ear doctor, ENT doctor, eye doctor. So that is causing a lot of problems. Still, UK, USA, Canada, nobody can go to the specialist directly. They have to go to the family physician or a GP. That is dying in India, which is very unfortunate. India cannot afford to have that. We can't have the American care here. We need to have more family physicians. In fact, I feel by routine in the medical college, 50% of the seats, the MBBS people should go for family physician training. Emergency. You should probably work in emergency for 3 months. So you know how to take care of an allergy or a cardiac arrest. So if 2 years family physician training, 50% MBBS do, and all patients cannot go to specialists directly. As a kidney specialist, I should only see if a patient is referred by a family physician or GP. No patient can walk into the chamber saying, I got kidney problem. Family physicians who should examine, they should check the blood pressure, check all the things. And if they think some tests are needed, then go ahead with the test. That's my feeling.
Yes, doctor. I find that fear is driving disease these days. That being said, having a good family physician would be the first step towards having better health and less stress. They could probably find a physician in close proximity that they feel comfortable with. Now, moving on to the next question. I find that COVID 19 actually has a lot of long term effects on patients. What have you seen in your practice?
I think because of COVID, the kidney cases definitely increased. I'm saying more of diabetes, the COVID-induced diabetes, COVID-induced, my wife had a stroke with no risk factors. I mean, she had no hypertension, no diabetes, life is normal, everything normal. She developed occipital lobe stroke, suddenly became blind. And she had 2 attacks of COVID and 3 vaccinations. So now they're suspecting it's part of long COVID. So we are seeing like that, the COVID, long COVID effect with the strokes, with the kidney problem, we are seeing that. So definitely COVID has an impact. There's no thing about it. And the other thing which you rightly said about, which I want to go back to the question you asked about internet. The Google actually is good with many things. I know you want to buy something, you want to buy a car, you want to buy a dress, you do Google search, you compare. The medical practice, unfortunately, I mean, I feel it is causing more problem. In fact, there is a term now coined called idiot, internet derived information obstructing treatment. I am surprised sometimes when I ask my patient, because the first question I ask them, why did you come to me? I asked them. You have seen so many doctors. They'll say, sir, I saw in the Google, you are rated number 1. I said, Google, I can do anything. I can be number 1, not in medicine. I can number 1 in acting also. Don't go by Google. As a nephrologist, I should be able to see. I say I tried kidney failure and I see what are the results coming on Google. Then any wrong information as a society, my society should take charge and say it is wrong. These are the information we should. So that is what I think we need. Some sort of regulation is needed for Google or any of those search engines. That's my feeling.
Yes, so the inference can be made by everyone. Like you rightly said, 2 plus 2 in our practice does not always equal to 4. It could be equal to 3 or 5. That being said, I'm seeing a lot of young people. I would not say students, but young people coming to me with a lot of stress. They're like, okay, we're having indigestion. Like, should we go to the hospital now? Do you think it's a heart attack? I feel a little sad for them too because they're very worried. And it's not a small worry, of course, because they have like the family to take care of and all those things as well. Of course, if you're above 50 and if you have indigestion, please get admitted because, of course, that is a risk factor. But younger than that, it is sad to see because it doesn't just give them physical symptoms, they also have a lot of mental stress these days, like anxiety and depression, because they've been given the entire responsibility for their health. Like all corporations tell you that, okay, you are responsible for your health, go earlier, prevention is better than cure. So everyone comes to us at a very young age. The minute they enter, like, their office space and all of that, they get their health checkup done, they do all of that, and some LFT will be this side, that side, it'll be a little different, but they start life with that stress. Is that required, or what can we do about it?
I think now the stress is increasing again. What I feel is the present generation is ambitious. They want something quick, fast. I want to achieve this. I want to buy a car. I want to go this. I want to become a CEO. I want to become so much within a short period of. So the ambition and aspiration, that's where the stress comes in. You don't have stress while doing seeing a patient or doing a procedure. I'm. I don't think I'll be perfect. With the stress, we can actually do good job. What is important is this. Distress is bad for the health. Somebody's work stress, if they understand, okay, they enjoy the work and they stress on the work, I don't think that will cause health problem. Distress will cause more problem. So stress is good, distress is bad, but some sort of, that is why I still believe, in my own practice, I still believe in some sort of meditation or some sort of relaxation of the mind is very important. Something like that also is good enough. I think we need more of that, I feel. Relaxation.
So, in the previous generation, doctor, what I found was people used to have financial anxiety, right? Like, okay, do we have enough money? We need to save for this, we need to save for that. And yeah, but now, since finance is a little bit more stable than what it was, not totally, but of course, a little bit more, now they have health anxiety. It's like completely shifted to this side. That being said, I found that, like meditation has helped a lot of my patients, and simple things like going for a walk in nature for half an hour, that itself seems to help a lot. And just releasing trauma from the body, because what I have found is once you hold on to negative emotions for too long, that itself manifests as a disease. But yeah, so what is your advice on how people should deal with this?
Everybody's stuck to the TV. Nobody wants to go outdoor. Just go for a walk to enjoy the nature. That is gone. I agree with you. I agree with you. Walk in the morning, even half an hour, or even say, I feel like you don't use the stairs, just take the lift. Everybody's taking the lift. First floor, I've seen my young people. They just take the lift. No need. You can use the stairs. That is good exercise. Just walking to the car. No need to park the car next to your office or house. You can park it away and walk. These even small things make a lot of difference. I agree with you.
So, doctor, what would your advice be for our viewers watching this video to have a healthier 2024?
We already discussed this. I think I would first say find a good doctor. That is important to have a family. That is my suggestion. Eat correctly. I think the problem now is salt and sugar. These two white substances are dangerous. We're eating too much salt. We're eating too much sugar. Definitely these two we should control. In fact, now we are having a crusade now, like chini kam, namak kam. We are now doing a procedure now. We are now trying to have this as a crusade. Stress-free smoking. A lot of youngsters are smoking, and I find very surprisingly, a lot of girls are smoking now. It's quite shocking. I mean, girls and boys are all equal. I mean, there's no difference. I mean, they can achieve a lot of things, but you cannot be equal to a man or boy by smoking. Alcohol is bad. But people drink, social drinking is okay. But so diet, that is important. Number two, I already discussed salt, sugar, stress. I've told you. Then also looking at the now I find a lot of people going into this gym, and then going on doing this with a high protein diet. High protein is okay, but they take, they inject some steroids, they take creatinine, they want the body to muscle building. Some of these drugs are dangerous because they are steroids, anabolic steroids, they're called, to build muscle.
Yeah,
They can
definitely.
the liver. I know cases where people have had liver failure because of that. So I wouldn't do that. Then the other thing which is important is also walking, which you already discussed. Exercise is important. Body weight. You should be fit. That's very important. You can be fat, but being fit is important. Sleeping well. A lot of people have problems with sleep. Again, because of stress, they're worried of the next day boss's target or something else, or they want to fight with the wife, husband, girlfriend, whatever. So sleeping well is important.
Yes.
Adequate hydration. I think that is all. As a nephrologist, I would say be
Uh-huh.
hydrated. Important. But when I say hydration, is not drinking 8 liters of water, because there are some of the alternate system medicine tells you that if you drink 8 liters of water, you're healthy. No, drinking more water is also dangerous. Don't go by 3, 4 liters.
Mhm.
The thirst is the best mechanism to take care. But I would say average 2 to 3 liters is good. So drinking adequate
Mhm.
water. And for women, they are prone for urine infection. My practice as a nephrologist, I see young women, even elderly women, regularly they have infections because they hold the urine. You don't pass through.
Yeah.
You, especially women working in places. Now, at least, thanks to the present government and other government working on toilets, we are getting more
Mhm.
toilets, cleaner toilets. But invariably, I find many of the working women, they come and tell me, doctor, I'm not able to pass urine because the toilet is so dirty. They hold on their urine 8 to 10 hours. They don't drink water because they think they have to pass urine. They get urine infection, which is dangerous. So, as a
Yes.
nephrologist, my suggestion would be drink enough water, pass frequent urine every 2, 3 hours. And if you are married, what I
Mhm.
call post-coital, after sex, you must pass urine because that is another reason women get
Mhm.
infection. Urine infection is a birthright of every woman.
Okay.
You know, so this is very
Mhm.
important. Nephrology, I would say.
Amazing, Dr. Sundar. It was lovely talking to you and getting your valuable insights. So, as you know, the current generation, they want everything to be 100 on 100. Like sleep has to be 100 on 100, food has to be 100 on 100, habits have to be 100 on 100. They're very perfect when it comes to things. But maybe that's not always required, and a balance is excellent. Balance in everything would probably give us a better year. But
Lakshmi, you put it very correctly. It is okay, as my friend Dr. Devi Shetty says, it is okay not to be okay. It is okay not to be
yes,
okay. So we must accept that. I think that is part of the thing. Overall, I would say
yeah,
my
it's part of
suggestion
life.
is avoid
Yes.
stress, diet, exercise, good lifestyle. I would call it lifestyle prescription. These are very
Mhm.
important. Good sleep is important. I think you can go a long way. You can even, I would say, you don't need to see a doctor if you follow this advice.
Yeah. Yes, yes, definitely.
Thank you,
Thank
Lakshmi.
you. Yes, thank you, Dr. Sundar.